An expert panel in Kerala has suggested the staggered lifting of the lockdown over the next 4 to 6 weeks. And many other states, as we've seen already, also feel that restrictions in some form or the other will have to go on for at least another 2 weeks after the 14th.
Indian states are preparing for what might be very crucial days ahead to contain COVID-19 spread, with less than a week left of the 21-day lockdown in India. An expert panel in Kerala set up by Chief Minister has recommended for a partial lockdown to continue and its removal in 3 phases. Lockdown first to be lifted from districts with no new cases between 7th to 13th April. Lockdown to be lifted in second phase from districts with no new cases in a fortnight. In the first phase, everyone to wear masks when out, private companies to operate with 25% staff on work site, no elderly with illness to be allowed outdoors except with special permission, only one from a family to be allowed out for non-exempted services, public gathering of more than 5 prohibited, marriages, funeral to allow only 10 people, movement of private vehicles to be restricted with odd-even scheme, no movement allowed on Sundays, targeted measures for livelihood revival with focus on migrants, farmers, MSMEs among others. However, Chief Minister has said the state's final decision will be based on the centre's decision.
ഇതുമായി ബന്ധപ്പെട്ടുള്ള നടപടികൾ വരട്ടെ, അപ്പോഴാണല്ലോ നമ്മൾ എന്ത് ചെയ്യണം തീരുമാനിക്കേണ്ടത്. ഇപ്പോഴേ നമ്മൾ ഊഹിച്ചുകൊണ്ട് ഒരു കാര്യത്തിലേക്കും പുറപ്പെട്ടതായിട്ടില്ല. 11-ാം തീയതി പ്രധാനമന്ത്രി കാര്യങ്ങൾ സംസാരിക്കും. പിന്നെയും 2-3 ദിവസമുണ്ട്. അതിന്റെ ഇടയിൽ നമുക്ക് കാര്യങ്ങൾ തീരുമാനിക്കാം.
While most states want the lockdown to be lifted in a phased manner, there are states like Telangana or even Uttar Pradesh that want an extension of a complete lockdown. But in all, states are looking at what the centre's final decision will be.
In Uttar Pradesh for now, 102 COVID-19 hotspots across 15 districts will be sealed off till April 15th. State has assured home delivery of essential items in these areas. Goa has already decided to extend the lockdown till April 30th, while Assam and Tamil Nadu are set to toe the centre's line. West Bengal Chief Minister Mamata Banerjee has emphasized on the need of a humane lockdown.
মানুষকে আমরা যেমন ট্রিটমেন্ট দিতে পারি, মানবিকভাবে মানুষকে আমরা যাতে হস্পিটালিটি না বাড়ে সেদিকে দেখতে হবে, মানুষকেও নিয়ম শৃঙ্খলা নিশ্চয়ই মানতে হবে, আমাদেরও মানতে হবে, এবং আমরা যাতে কড়াকড়ি করবো বা বাড়াবাড়ি যেন না।
Telangana has supported a complete lockdown extension. Andhra Pradesh is set to isolate critical areas based on massive rapid testings, pushing for lockdowns in only red zones.
Government of Andhra Pradesh is also going for a pre-screening facilities. Probably it could be through an antibodies kind of system, where we, through this screening, that is, the rapid screening, we can at least identify the green zones, the green communities which are not affected, and communities where which are affected. We can localize the infections or the virus to that particular point and make sure we create a buffer zone over there.
People across the country certainly worried about what an extended lockdown could entail. There is concern that a break in the supply chain could lead to a chaotic situation. Saving lives, saving the economy and social order, a most difficult balancing act. With Sneha Merikoshi in Thiruvananthapuram, Moridipa Banerjee in Kolkata, Alok Pandey in Lucknow, Ratnadeep in Guwahati, in Hyderabad, Uma Sudhir, NDTV.
Well, KK Shailaja, the Health Minister of Kerala, are now joining us on NDTV this evening. Thank you so much for joining us, ma'am. Just looking at that report that the expert panel has put together on suggesting a very phased, staggered exit from the lockdown, is that what the Kerala government is officially endorsing as well?
Yes, our Honorable Chief Minister expressed our opinion that we are waiting to see what Honorable Prime Minister and central government is deciding about the lockdown, whether continue or what is the action next after April 14th. We are waiting for that. Now we are continuing the strict surveillance and stringent actions according to the lockdown declared by Government of India, and we should have to continue the stringent actions until the pandemic curve become low. That is our opinion, and we are waiting for the opinion of the Government of India and Honorable Prime Minister.
But ma'am, on this particular report, which the expert panel has recommended, it's basically looking at a staggered sort of exit over the next 4 to 6 weeks. It even says that flights and trains should not start until the end of May. Apart from what the centre may decide to do, is that something the Kerala government feels it would be the right approach?
Yeah, it is not an opinion. It is only an opinion, and it is not a decision. We should have to take decision according to the other states also, because this is a pandemic. This is not only appeared in one state or two states. All over India it is spreaded, and we have to take any decision according to the central government, according to the situation of other states also. And that expert opinion is a suggestion. Out of that suggestion, we can wait and see what central government is deciding. Central government should decide or will decide a proper thing according to the whole situation all around India, and we will also obey that thing.
Ma'am, can you give us an update on the number of cases in Kerala specifically, and where you see the trajectory in Kerala at the moment?
Yes, we have today 259 cases, positive cases under our isolation in hospitals, and we have already 345 cases, out of which most the remaining patients recovered and discharged, only 2 deaths. The death rate is 0.6. That is an achievement, we can say, because of the strict surveillance and also strict isolation and treatment. And testing also, we have tested more than 11,000 samples, and that is also a good sign, and from that we can yield a good result out of this, and the death rate is 0.6. I think in the world it is almost 5% like that, above 3% in almost all countries, and in other states also it become more than 3% and like that. But we are not making a final decision on this, because as the virus is spreading in other states, we should be more eager whether the graph will again come up. That we are waiting, and today we have a good result. Only 9 cases reported today, out of which Gulf countries from the Gulf returned were there. There were 4 cases.
Only 9 cases.
And 2 Nizamuddin cases and 3 contact cases.
Right. So
only 9 cases
only
reported
that's a good sign, ma'am.
Out of which 9 cases, only 6 is the is the positive case and 3 is the contact case. That is also notable.
Just one final question, ma'am, on testing, because Kerala has taken the lead on this. As you mentioned yourself, there have been a large number of tests conducted in Kerala. Are you going to look to expand that further, look at more random testing? Do you think that is needed?
Yes, we are thinking about that. In the first phase, we have only 1 testing lab, that is NIV Alleppey, and now we have 10 labs. ICMR give us permission to test in other labs, and we have 10 labs. 11,986 PCR tests had done, out of which 10,906 samples are negative. That's a good result, And we are thinking about that antibody test also, and we are waiting for the kit for the antibody test. ICMR give us permission to have the rapid test, but we didn't get that kit for the antibody test. We are waiting for that.
Do you know when you get it?
Kit,
that test is very important.
To have some. Yeah, within 3 or 4 days we are expecting. Within 3 or 4 days we will get that, and after that we can do the sentinel surveillance test and the random checking, etc. We are having a very good planning for that. We will do that.
All right, ma'am. KK Shailaja, the Health Minister of Kerala. Thank you, ma'am, for joining us tonight, giving us a perspective there. Hopefully, that good news from Kerala will continue over the next many days as well. Only 9 new cases being reported there in the state today.